Hello friends, I am Dr. Darpan Thakare, a consultant neurosurgeon practicing in Bombay since last 15 years. I have been associated with S L Raheja, a Fortis Associate Hospital, and I had the privilege to manage a lot of trauma patients over here, including the brain and spine. So today I'll be briefing you about prevention and management of head injuries. It's a very vast topic which cannot be completed in a short time. But yes, with the increasing number of cases coming in because of the road accidents, the construction which is going on, the gunshot injuries, the war which is recently happening abroad. So we do come across cases coming in different Glasgow Coma scores. The head injury when the patient comes to the casualty to the ER, the primary team assesses the patient. Patient has to be sent for an urgent CT scan. He has to be checked for other injuries like spine, chest, abdomen, pelvis, long bone fractures. He has to be hemodynamically stabilized. And then once the role of a neurosurgeon comes, wherein the patient has a fracture, a extradural hematoma, a subdural hematoma, subarachnoid hemorrhage, diffuse axonal injuries, these becoming the primary injuries and the secondary injuries because of the hypoxic damage to the neurons. So depending on the condition, the GCS of the patient, we take a call whether the patient needs to be admitted in the ICU and monitored with a guarded outcome, or he needs to be rushed in the OR and taken up for an immediate surgery. So the time for us to do all this should be less than half an hour to 1 minute, because the more you delay, the more it takes time for the patient to get diagnosed, the more the brain damage happens. We should be aware that along with the brain injuries, there are displaced fractures of the spine. So while mobilizing such patients, we should take care that the patient is log rolled, he's strapped properly, and then we screen the spine as well. So when it comes to the investigations of such patient, besides the routine investigations, we do the CT scan of the brain, chest, abdomen and the spine. Depending on the type of damage which is seen, the patient goes in for a decompressive craniotomy. So there is a big role of the anesthetist and the ICU team which takes care of the patient to manage the intracranial pressure, which has to be immediately taken care with the anti-edema medicines. Then there has to be prophylaxis taken care for the seizures, wherein we load the patient either with Liptoin or Levipil. We have to maintain the MAP, the cerebral perfusion pressure, intermittently keep on checking the patient's GCS score, the pupil size, and accordingly prognosticate the relatives about the patient. So sometimes it's a heraldous task to take care of such cases, wherein if the patient is a young patient or a child, the parents are anxious and the family is anxious, we need to be very careful in picking up whatever injuries are there and putting it across. Moreover, these cases are medico legal cases wherein the police are involved. So the documentation of all such injuries from head to the toe, they have to be done precisely. So I think this huge topic of head injury needs vast experience, which our team at Raheja is very well equipped with, and we have the latest technology and the management skills, a good ICU backup and a OR to take care of such cases. Please take care of yourself, wear your seat belts, don't be on your mobiles when you're driving, wear your helmets, see to it that your car or your bike or when you're crossing the road, you have to be vigilant, and take care and good day. Thank you.